Hello and welcome again to this edition of FiTV. I'm your host, Brad Swanson. We are coming to you just a few blocks from Florida's capital, where agency heads, the governor, and the cabinet members are all engaged in responding to COVID-19. Florida has certainly beaten a lot of the odds when it comes to responding to flattening the curve. My guest today is Emmett Reed, President and CEO of the Florida Healthcare Association. Emmett, welcome.
Thank you, Brad.
All right, so we're here. You were at the cabinet today. A little bit about your industry. Over 550 nursing homes across Florida. Less than 1% of long-term care residents have tested positive for COVID-19. You guys have been distributing materials to your people, working with Jared Moskowitz at the Department of Emergency Management. Over 10 million masks have been distributed. Those are some pretty impressive both numbers and materials that you guys are using. How you guys doing?
Well, I tell you, thank you, Brad. Those are some good numbers. We're proud of them. We don't want to boast, but we're definitely leading the nation and taking care of Florida's frail and elderly. And I believe it's a collaboration between the Florida Healthcare Association and Governor DeSantis' administration. He has truly made, like you said, Secretary Moskowitz, Secretary Mary Mayhew, the Surgeon General available to us. And it's really been a 7-day-a-week, 24/7 type of collaboration between the entities, and that's made a huge difference in those, and that's why those numbers are so good.
Yeah, I mean, the day has been, of government work, whether it's this kind of a crisis or a hurricane, but this totally has rewritten the script. You and I are 6 feet apart, socially distanced, working inside the trenches. Normally you're shoulder to shoulder, but we've got to conduct this business with a bit of distance, but with an immediate reaction. So tell us a little bit about what your industry is doing to ensure the safety of all the Floridians that are in Florida's nursing homes.
Right. Well, the first thing that happened in nursing homes, we're asking for this, is the governor came out with an emergency order to stop visitation in a nursing home. So all visitors were stopped, and that was to keep the residents safe. Now listen, there's a huge psychosocial toll that is being taken right now on the residents because they're not able to see their loved ones except maybe through a window. You might have seen some of those photos, things of that nature, and that's why I applaud our long-term care workers, because they are really surrogate family right now. A lot of times they are anyway, but now more so than ever. They're entertaining and taking care of the residents in a nursing home. A great example is they'll do hallway bingo instead of having them all in a common area doing bingo. Everyone's in their doorway, and the nurse at the nurse's station or wherever they are, or the CNA is calling out bingo numbers and just trying to give them some semblance of normalcy.
Right. Well, I mean, I can imagine the creativity that's being deployed by that industry, and it's already amazing what you do in some of these most modern facilities, and what we kind of grew up thinking a nursing home was like versus the modern amenities. It's amazing. All right, well, let's move into you and your industry and your association's interaction with the governor in terms of long care facilities. Tell us a little bit about the regional approach and initiatives that Governor DeSantis and your industry are taking to protect your residents and frankly anybody that has a family member in those industries.
Right. Well, yes. It was, again, another initiative that the governor took, and it's after a lot of meeting with state officials, is that hospitals are now required to keep COVID positive patients. They're not allowed to push them into the nursing homes, which if you saw in New York, that happened. And literally that cost thousands of lives. In Florida, that didn't happen. The governor listened to his consultants and the people around him and quite frankly, probably his gut, and said, no, the safest place right now is in a hospital. So that's number one. So they're in the hospital until they test negative twice, and then they can go back to the nursing home. Some other things is that we test employees every single day before coming in. Obviously, we're doing all sorts of checkups on the residents to make sure that they're not showing symptoms from COVID-19. But the real tricky thing, and sometimes you'll read about maybe an outbreak in a skilled nursing facility, the tricky thing is that you can be asymptomatic and not have symptoms, right? And come into work at a nursing home and be spreading it and not even know it. So that's why the importance of the more we can get this rapid testing up and running, which it's coming and it's getting better and better, the more we're able to do that, the more success we're going to have in keeping it out of a nursing home.
Well, I mean, that's an incredible strategic decision that the governor and the industry and the agency heads worked on versus some of those other states, because that proliferation of COVID into those populations just. It was a tragic calculation. Again, these are new paths for every state that's facing these decisions. But thankfully, Florida once again was ahead of the curve. Well, great. Well, thank you for that. So let's talk a little bit about a technology-related item that nursing homes are using. Our industry has long been a proponent of telehealth. It's obviously our broadband technology that enables that interaction between caregivers and patients. How is telehealth helping patients in your nursing home facilities that it's not about COVID, but they're normal day-to-day maladies? Tell us about what telehealth is doing.
Yeah, telehealth is becoming more and more prevalent in all phases of care, and especially in long-term care. And it's an absolute godsend to be able to have a nursing home resident not have to leave their home to consult with a doctor. It just is quicker, it's easier, and it's very effective. And we're grateful for the technology and looking forward for the expansion of it.
Yeah, well, it's a known fact, at least amongst our industry, but 97% of Floridians have access to that high-speed broadband. But I have yet to be in one of your facilities, and I'm grateful that you let me tour those in the past, that isn't wired to the gills for that type of technology. So,
and we're grateful for that technology. Yeah. You guys do an amazing job.
Well, I think the industry leaders and your members are, as you have already said, they lead the nation already. But obviously, as a response to COVID, they're just showing that they're doing that again. So,
absolutely.
All right, well, Emmett, that's all the time we have for today. In one final thought, when you think of what's next for COVID and the nursing home industry, what's the top thing you're telling your people?
So right now, we are trying to figure out, how do we allow normalcy to reign? How do we allow visitors to come back and see their loved ones and hug their grandmother, grandfather, aunt, uncle, brother, sister? How does that happen? That's number one. Number two, how do we keep it from flaring up again?
Right. Well, Emmett, thank you so much for coming on FiTV and sharing with us what's happening currently. I love the forecast of what we're going to see next, and I'm sure you and your industry are going to be bringing a ton of great imagery of families reuniting with their family members that are in those nursing facilities. Thank you for all that you do, Emmett.
Thank you, Brad.
Thank you. That's all the time we have for today's episode. Make sure you hit us up on our Facebook and social media for more great interviews like this one. And for now, thanks for tuning in.